Welcome to episode 42 of the Pulse of Physiology. I'm your host, Dr. Jim Davis, and today we're discussing cardiac output, which is the amount of blood pumped by the heart in 1 minute. Cardiac output is a key determinant of oxygen delivery to tissues and is tightly regulated to meet the body's metabolic demands. By the end of this episode, you should understand how heart rate and stroke volume interact to determine cardiac output, how to calculate cardiac output, and the significance of ejection fraction and cardiac reserve. So let's dive in. Cardiac output, often abbreviated as Q subscript C or simply CO, is the total volume of blood pumped from the ventricles per minute and is calculated using the following equation: heart rate times stroke volume, where heart rate is the number of beats of the heart per minute and stroke volume is the amount of blood ejected per beat. Normally, we measure cardiac output in liters per minute. So for example, if heart rate equals 70 beats per minute and stroke volume equals 100 milliliters per beat, that would mean that cardiac output is 7,000 milliliters per minute, or 7 liters per minute. Now, a normal resting cardiac output is approximately 5 to 6 liters per minute, but this value can increase significantly during exercise to meet oxygen demand. Now, since cardiac output is the product of heart rate and stroke volume, changes in either factor will affect overall output. Increasing heart rate will increase cardiac output if we assume stroke volume remains constant. Similarly, increasing stroke volume will also increase cardiac output, assuming heart rate remains constant. Often, when one variable increases, the other compensates to maintain cardiac output. For example, if stroke volume decreases due to something like blood loss, heart rate may increase to compensate to maintain adequate circulation. So this leads us to cardiac reserve, which is a measure of the heart's adaptability. Cardiac reserve refers to the difference between resting cardiac output and maximal cardiac output. This value indicates the heart's ability to increase output during physical activity or stress. A high cardiac reserve suggests a healthy cardiovascular system. However, a low cardiac reserve may indicate heart disease or some sort of compromised function as the heart is struggling to meet increased demands. Then there's also ejection fraction, which gives us a way to measure heart efficiency. Ejection fraction is the percentage of blood ejected from the ventricle during each contraction, and it is calculated as stroke volume divided by end diastolic volume. So if you recall, stroke volume is just end diastolic volume minus end systolic volume. End diastolic volume is the amount of blood in the ventricle before contraction, and end systolic volume is the amount of blood in the heart or in the ventricle after contraction. For example, if end diastolic volume is 140 milliliters and end systolic volume is 70 milliliters, that would mean our stroke volume is 70 milliliters, and so 70 milliliters divided by 140 milliliters gives us 50%. Now, a normal ejection fraction is about 55 to 70%, which indicates healthy heart function. Heart failure is indicated when ejection fraction is less than 40%, meaning the heart is not effectively pumping blood. So let's summarize with 4 key takeaways. Cardiac output equals heart rate times stroke volume, and it's measured in liters per minute. Next, increasing heart rate or stroke volume will increase cardiac output, but the body often compensates when one changes. Cardiac reserve reflects the heart's ability to increase output under stress, with higher reserve indicating better function. Ejection fraction is a key measure of heart efficiency, with values below 40% indicating potential heart failure. And so that's it for episode 42 of the Pulse of Physiology. I hope this episode has clarified how cardiac output is regulated and why it's essential for cardiovascular function. Join me next time, where we'll explore pressure volume loops and how they illustrate heart function in real time. Until then, keep questioning, keep exploring, and stay curious.